My name is Dolly Ajok. I work with the Heroes program as a Youth and Community Engagement Officer. I work in East Central Cluster. I'm very excited for the program and I'm glad it has such a position because youth for a long time, as the saying, as their slogan goes, nothing for us without us. Sometimes the youth programs put in place and you don't find young people working in it. I'm 34 years old. I'm very glad to be a part of this team, seeing that there's transformation going on to my fellow youth in the community. East Central Cluster has 4 districts, as you might already be aware. That is Uganda, Namayengo, Mayuge, and Bujiri. And the uniqueness that these districts projected, especially during the baseline that we did with ministry and other partners that work in this area, teenage pregnancy was one of those key issues that was a red light. Up till now, I think in the recent statistics you can see Mayuge is still up top. 6,000 young mothers out there, mothers like our youth said, children, babies with babies. The number is still skyrocketing. Uganda is around 4,000, 5,000, basically the whole region. But I can't say only East Central Cluster. The whole of Uganda, especially post-COVID, has brought a lot of effects for the girl child, for women around SGBV, access to services. We all know during the lockdown, many of the survivors were at home. They cannot go to report a case because of curfew restrictions, and many of these people either died in silence or survived somehow in silence because you cannot go somewhere, you're restricted to move, but also COVID itself aggravated everything that was already happening. If it was the issue around food, this time the man is not working, neither is the woman. So you have to find a way to survive. You can't ask, you'll be assaulted. So the region suffered gravely. But I'm very excited that the program is here. We are doing a lot with youth in Mayuge, in Bujiri, in Namayengo, in Iganga. As you'll see, the youth are even more excited than I am. We have done training so far for youth heroes, and we have done a small number, 20, 24, 12, depending on the number in each of the districts. And the youth are doing different tasks in these communities. There are those that are reaching out to fellow youth to link them to services, because some of the issues are around accessibility. And access is not just about the roads, but even the friendliness of the service. Are the health workers willing and ready to welcome these youth? If a young girl of 14, 15 asked for a condom, is a health worker willing to give them the condom without prejudice, without judging them for asking for a condom? If they came with an STI, are they going to be treated without judgment? If they came for a family planning method, maybe an implant or an injectable, are they going to be given that service? Following, of course, our health policies and laws that are in place. I pledge that, 1, I'll support youth to access youth-friendly services at the facilities through the program. 2, will enable them get the right information when they reach to those service points. 3, be able to transfer that information to other youth within the community. But also support women to be able to enjoy their rights, fully enjoy their rights within the community.